Welcome everybody to this first session in Research Education and Innovation Week for Children's National. My name is Patrick O'Keefe. I'm the Administrative Director for the Clinical and Translational Science Institute at Children's National, CTSI-CN, which is what we'll be calling it from here on out. And originally we were going to have the Director of the Institute, Lisa Gay Woodford, Dr. Lisa Gay Woodford come in and join us, but she's had clinical duties pull her away. So I'll be presenting a lot today. And then also our co-director, Remer Bouchard from George Washington University, is the Senior Associate Dean for Health Sciences. He's also going to be joining me here and presenting alongside me.
Good morning, everybody.
Great. So the reason we wanted to come present today was to kind of reintroduce ourselves. I know that folks across both Children's National and GW have their own interactions with CTSI-CN, or they may have seen CTSI-CN across during their research endeavors, but maybe don't understand everything that we do or the impact that we've had on our institutions and the research enterprise. So we wanted to step in and kind of present today and walk you through not only some of what we offer, but some of the impact that we've had and the ways that we've accelerated research both at Children's and GW and across our CTSA network nationally. And you can feel free to post any questions or anything in the chat. We'll be monitoring that, and we can stop at any time to address any questions you may have. So overall, who are we? We are a collection of faculty leaders from across GW and Children's who have expertise in a wide range of research areas and specialties and services. And then we come together as a collective, and we're supported by a staff of anywhere from like 5 to 15 folks at any given time who help navigate folks towards resources and provide direct support to researchers. This is from pre-COVID times, by the way. It's been a while since we've been able to get together the way we like to. So we are supported not only by our institutions at Children's and GW, but by a grant from the NIH's NCAT Center, which is the National Center for Advancing Translational Science. We're one of 50-ish, 60-ish hubs at any given time, and the hub is an institution that has been designated and given one of these CTSA awards. Hubs are generally a collection of multiple hospitals, academic institutions, other research institutions generally in a location, and so there's several in different cities all across the country, and ours is one of those, and we are a partnership between Children's National and GW. And one of the things that we do as part of this partnership is connect our institutions with the larger network and with the national, what's going on nationally in research. Just a little bit more about the CTSA Award Consortium. The consortium itself was designed to ensure new discoveries lead to improved public health. So these hubs support their institutions by helping to accelerate biomedical discoveries and catalyze change and kind of break down some of the barriers and hurdles that are naturally occurring in complex organizations like the ones that we support. So the way we support research is really broad, but and it touches a lot of different areas. But this is kind of a compact way of showing everything that we offer and some of our core values as well. So you'll see in the middle some of our mission and core values are enabling investigators and providers, empowering patients and communities, and also promoting health equity in CTR, which is something that has become an emerging focus for us and something that we've decided to spend to make a big part of what we offer going forward. So we won't go around the whole circle here, but you'll see that we touch everything from data science to community collaboration to translational workforce pipeline folks, to trials across the country and here. So the resources and the highlights that we'll be showing going forward will give you a little bit more color for what we've got going here. And I'll check in the chat. Okay, looks good.
Patrick, I'll just add before you move along, as we think about sort of what all these programs and modules do, as Patrick mentioned, is trying to accelerate our ability to translate new knowledge into interventions and services and treatments. And there's no better example in recent times than during the pandemic, how groups like the CTSI and others were able to sort of overcome that typical slow road from discovery to implementation around priority. So our hope is to sort of replicate the kind of models that happened during the pandemic and do that in a more broad way. So thanks for letting me add in.
Yeah, of course. Thank you, Reber. All right, so that's a little bit about who we are. Move on to like what we do, and this is Joanne Wilson, one of our great dedicated staff. So I think with the takeaway that we usually want you to come away from this introduction to the CTSI-CN is that we're your research support center. So as I mentioned, we've got we can help in various stages in the research process, and we have a lot to offer. So in education here, you can see we support online graduate programs. We help develop them and support them in clinical translational research and for clinical research professionals. We also offer seminars and workshops on a regular basis, and I'll go into a couple of those later. So we're out there presenting and disseminating research. We're also helping researchers directly with study design. So we support a host of recruitment tools and other data management tools that can really help organize and boost your research and give you access to data that can speed along your protocol design, your study design. Then we also have a host of biostatistics and informatics faculty and staff who support investigators on a regular basis. They're written into grants. They help with study design and also with data management, and that's one of our more popular resources. So study conduct, we have a clinical research unit with clinical research professionals. We have a pool of clinical research coordinators that folks can hire parts of, and we have research nurses, we have lab services. These are some of the things that we host to support that can help for investigators and teams who may not have the full bandwidth of services available at their fingertips. These are things that you can get on an ad hoc basis to help with a project or to help with a pilot, things like that can really help boost your research. And as a multi-site engagement, which I mentioned, we can help connect you. We do help connect investigators on a regular basis with studies that are coming in nationally, like some of the COVID work that's happening now, but we also help to help investigators reach out to the broader national network and engage with folks across the country. And then in terms of dissemination, we host events like the Science Cafe, where our community folks go out into the community and engage with the community and get their feelings on what's going on, what health research needs they see, how our investigators can better connect with the community. And we also support a youth advisory network, which brings young folks into the research process, provides educational experience, but also is a resource for our researchers as well. So that's a little sampling of what we can offer, but we're trying to give you like a broader overview of what we offer so that you get a sense of the breadth. So a little bit deeper into a couple of these. For informatics folks, I mentioned we have tools for study, recruitment, and big data access. We have a lot of REDCaps where we support REDCap both here and at GW, Children's and GW. We have really knowledgeable REDCap folks who can help with your design and your database management. The Case Special Interest Group is one of our most successful regular seminar series. So we have monthly training sessions on topics that are aimed at early career investigators, but generally are of general interest and those bring in speakers locally and nationally, and those are always really lively and great. And the Grants Enhancement Program, which you may have heard of, is something that we also support. So that's the grant development program that helps junior faculty put together, compelling grant applications and provides them with mentorship. And it's been extremely successful in doing that. The virtual organizer, which Reamer will talk to in a few minutes, which is an online tool that we use that's part education, part resource organizer. And then, as mentioned, some of the biostatistics and epidemiology and research design support that is part of the core offering. So
Patrick,
how we accelerate research.
Patrick, do you mind if I mention one comment about big data before we move on?
Yeah, go ahead.
Just because it's one of the most common things we get asked about. And I just wanted to mention a couple ways that folks can get support from the CTSI-CN around big data. So Patrick will talk a little later about Pizzanet. We also work closely with Cerner, Learning Health Network, and other big data sets, millions of lives and encounters across the country. But there's a couple different ways that we support investigators and research teams. One is by evaluating the feasibility of your research question to help you find a large data set that can give you the best, most generalizable result. We can support you also to use those data with technical and experts that can manage those databases. We can also help invite or connect you with others around the country that together have a population that's well suited to answer a particular question or conduct a study. But one of the other things that we've done more of that was sort of a little newer to me is that as we work with big consortia of data, of research data groups, as they learn a little bit more about the types of individuals and communities we serve, they can also come to us with opportunities to implement a portion or a site for their trial. So the benefits of big data and access really work bidirectionally. And it's I think one of the greatest strengths that CTSI-CN can help you as researchers.
Yeah,
thanks, Patrick.
Absolutely. Thank you, Reamer. Absolutely. Okay, so moving on, we wanted to touch a little bit. So, we've talked about some of the things that we offer. We talked about who we are, but I wanted to give some examples of how we accelerate research, not only on an individual and research team basis, but across both of our institutions and nationally. So this picture is some of our wonderful research nurses from the clinical research unit. So I think, given what's been going on the past couple of years, I think it would be timely to talk about some of the ways that we've mobilized to help investigators and our hubs respond, and our institutions respond to the COVID-19 demands. So here you'll see that we supported the workforce by awarding a series of vouchers. So vouchers for services like biostatistics support or community support or things of that nature, giving free hours to folks for projects that needed like an immediate boost of support. So we awarded a handful or 10 of those. We supported a number of investigators, over 60, for proposals through our study design and REDCap support and other tools that we offered. And that support in turn resulted in over 350 publications. So there's been a lot of the way that we accelerate research is it also tends to have a beneficial effect on on how quickly and how widely things can be disseminated. So for in terms of promoting collaboration and community engagement, we helped support over 150 studies that had to be transferred from outpatient clinics due to some of the extraordinary things that had to happen because of the constraints of responding to COVID-19. We also helped develop a regional demographic database for disparities in pediatric testing, and that was with CHI, the Children's Health Advocacy Institute. And then we used our nurse staffing pool to help staff a children's and DOH collaborative to screen healthcare workers for seroconversion. So that was a big citywide effort that we provided support in that helped accelerate some research involving healthcare workers and COVID-19. In terms of informatics resources, I mentioned we helped develop REDCap databases for individual investigators, but we also developed one and a wiki to aggregate all the studies happening both at Children's and GW that involved COVID-19. So that was over 70 investigators there. And then we've also led the participation and contribution to larger national networks. So the NCAT's National COVID Collaborative, N3C, which has millions and millions. Last I checked, I think it was in the 8 to 9 million records for COVID positive folks, or not COVID positive folks, but in general health records across the country. And that we've contributed almost 60,000 and counting of our own patients from both children's and GW to that large pool of data, which is a pool of data that we can help you utilize and take advantage of as an investigator if that's something that you are interested in.
It's 12.5 million patients, Patrick, and 4.5 million of those as of this week include COVID positive patients. So really, really great database as you should.
Yeah, exactly. Thank you. And you can see the potential for the power of utilizing a tool like that. And that's how we are contributing to the national network. And then in terms of new processes, when you talk about accelerating research, a lot of that involves creating new processes, updating processes. So one of the things we did was we developed a REDCap-based e-consent process for certain studies in partnership with the IRB. So that was very useful in the age of telehealth, in the emerging telehealth field to help with research. And then we helped streamline the biosample accrual for COVID-19 and distribution from our central biorepository. So that's something we also accelerated to help move research along quicker. And then we also accelerated the review of protocols by the Scientific Review Committee, which helps to catch potential problem areas in protocols during the IRB process to speed up the IRB process as a whole and cut down some of the back and forth between the IRB and the investigator. So these are just some of the examples of how during the COVID time, during the COVID pandemic period, which is obviously still ongoing, we've been using our resources and our folks to make sure things are moving faster to respond to the current needs. So Reema, I wanted to pass it off to you to talk about some of the other contributions, not necessarily COVID related, that we've been a part of for the past few years.
Absolutely. Thanks, Patrick. So we'll share a little bit about some of the contributions from CTSI-CN, and our hope is that you might see how our work and the processes and the programs that we support can help you and your team advance its work and your career. So just a few examples. One of the things that you've learned about so far this morning is the CTSI-CN does not conduct research itself generally. Its purpose is really to support quality, rigor, and efficiency and help develop the people involved with the research process and forge the relationships with the community that will sustain that important work that each of you does. But what we can do is we can bring people together, we can share resources, we can adapt and adopt ideas from the CTSA consortium around the country that help us really accelerate the work that we're doing. And so these are a few examples of how we've been able to leverage those support and resources to do that. One is by helping in the development of training awards. So the CTSI-CN, for example, has leveraged our resources and expertise to help support 5 successful new T32 awards, both at Children's National and GW, as well as 2 R38 awards. These are critically important as we grow our workforce and grow opportunities for people to get their careers off the ground. And I lead one of these T32s, and I can tell you I wouldn't have been successful without the support of the CTSI-CN, and our program would not have been as strong as it was if we weren't able to learn from what was going well and to tap into existing activities across our 2 institutions. So that's one great example. Another is being able to facilitate our local hubs' participation in multi-site initiatives that are happening within the CTSA consortium. I'll give you 2 really good examples. Naomi Lubin, who's one of your fine faculty at Children's National and well known for her leadership in workforce development, has helped study a customized career development program, which is an innovative new way to build connections between mentees and mentors and to study how we can best support the career development of early career scientists. So we are participating with new knowledge and refining processes that hopefully hubs like ours and others around the country can use to support mentor-mentee teams. Another project is the Building Up Initiative, which is a NIH-supported effort led by the University of Pittsburgh, where individuals who are pursuing research careers who come from backgrounds that are underrepresented in medicine and science can get special support to build their network, to develop their skills, and also to grow in their research capabilities. And so we were one of about 20 sites around the country that implemented building up. And in fact, we were the first one in the country to fill our cohort. So we're a little well known for that work. And we had some fantastic folks from Children's National and GW participate in that program. We also have seen, and this is a real tribute to the great work happening at Children's National, is we're able to tap into supplemental awards that are really exclusively available to CTSA funded institutions. So a terrific example is a supplement that Children's National and the CTSI-CN is leading with NIAID to advance studies of children with disorders of immunologic regulation. And this is a good example of how we can expand our research programs as a CTSA hub. We can keep going, Patrick. Thank you. A couple other just examples is the U Award, which is the larger part of the CTSA, really is our infrastructure award, and it's paired with what a KL2 program, but the U is really what provides support for the infrastructure to accelerate research and create the support that research teams needs to move ahead. And these are a few examples. One is Fabric, which our informatics teams, both based at Children's National and also in the schools of medicine, health sciences, and public health at GW, built a cloud-based network to support the development of software and housing clinical data, as well as to provide access to applications to study that data. This is a tremendous project, multi-year project, but it's helping to facilitate collaboration and research in human studies. We also established REDCap and have our own dedicated support person that's able to develop, adapt, and design and support REDCap at both our institutions now. This is also a great example where Children's led the way in the development of a research tool, and then GW was able to learn from that and replicate it. And that happens in both directions. This is one of the benefits of having this dual membership in the CTSA here in Washington. Patrick is going to talk a lot more about Children's National's membership in Pizzanet and how that can give you access to some incredible collaborations and data to advance important and yet addressed research questions for child health. And we've also facilitated the access to large data sets. We were able to improve the relationship between GW and Children's to share data for particularly issues that involve transitioning care from childhood to adulthood. And also we've been making great progress with CRIS. Some of you may know, but CRIS is our regional health information exchange and really collects data across a wide variety of categories, from demographic data to social determinants data to clinical data from all of the hospitals and practices in our region. And we're able to work with them to study important questions. And I would imagine this is a relationship will continue to evolve. So the regional health exchange institutions like ours really become the research heart of that research, of that regional health information exchange. We keep going, great. A couple other examples. One of the sort of the principles of CTSAs is that we understand that the best science comes when individuals from different disciplines and different expertise work together. They disrupt the way that we typically approach. They help broaden the outlook and the perspectives in the design, implementation, and dissemination of studies. And we also know that the best research and that will be most generalizable is done in partnership with the community. It's not done to a group, but it's done with the group so that we learn from those individuals that we serve and engage them in both the development, the conduct of the study, as well as how that information is shared and used. And so our community engagement and teen science teams work very hard to help support that work. And these are just a couple examples of some of the fantastic work those teams have done, including the DC Health Matters portal, including many science cafes that brought groups together and expert speakers to engage in dialogues about contemporary issues involving our community, and also trying to improve the way that our institutions value team science and multidisciplinary collaboration. You can see an example here where we help to facilitate a more progressive look at appointment, promotion, and tenure around team science. And Patrick mentioned some vouchers and some words earlier. We also shared money to help bring people together that might not easily be able to do that on their own, to study an issue together. And you can see that that investment we have has a great ROI. The follow-on funding that came from those pilots is really impressive. And we take great pride in the fact that those teams are continuing to do their work together. And then one of the other things I'm particularly involved with, as is Patrick, is our workforce development and research team development programs. This is another essential part of the CTSI-CN, where we understand that the work that we do is only as good as the capability and the engagement and the talents of the people that are doing that work. So we have a number of programs that support research staff members, early career investigators, and even those that are more established in their career to help continue to advance their capabilities, their ability to work in teams, and their understanding of new and novel methods for biomedical research and translational science. So just a couple examples, we have hundreds of early career investigators that have been a part of our grants enhancement program. And you can see that team has tremendous success in improving the likelihood of funding in a revised application. This is also a great example of how some of our most successful senior researchers are able to give back to early career investigators and share their insights and perspectives with people that are earlier in their career. We've been able to provide a significant amount of pilot funding, help people get that early data set up and be in a position where they can then compete for larger awards, extramural awards. And again, the follow-on funding from the pilots is just fantastic. And I'm always impressed not only with the quality of the pilot work, but the impact and the way that they are really addressing critical issues. And many also think about health equity and the impact of their research on our local community. So this is another fantastic. As a pilot awardee, you're not just provided funds, though you're wrapped around in the support and services of the CTSI-CN. So while it's great to have that startup money to advance your research, you're also being supported in the development as a scientist, which I think is a big value added for those programs. Children's led the way in bringing good clinical practices training to your institution. And GW followed suit shortly after, learning from the experience at Children's. And so through the Association of Clinical Research Professionals, we're able now to provide a tremendous amount of GCP training, as well as information and training for new PIs. And this is done in a virtual asynchronous environment. And it also allows people, particularly research staff, to move forward to gain the training they need to sit for national certifications as research professionals. So we're a close partner here, and I think this is another great success. And again, it doesn't cost anybody a dime to engage that training, and we've made it flexible so that you can do it when your schedule allows. And then we've also had close to 500 members of our community in CTSI-CN supported educational program. These include certificate programs focused on clinical research or clinical trials. They include degree programs based on clinical translational research and even a PhD program in translational science. And so this is also not just a career advancement opportunity, but we see people really taking what they've learned in maybe an entry-level research staff position and really advancing their career and moving forward through these degree programs. So this is something that we're really, really proud of. We also see tremendous diversity within these programs from a demographic background as well. And then one of the other things that we did, which I'll talk a little bit more about, is the virtual organizer, which is our navigator, a cloud-based navigator to help research teams find their way through the very complicated ecosystem that is academic medical research center. So a couple other things on as we sort of move through the different facets of the CTSI-CN. Some wonderful professionals at Children's and GW support our BIRD, or Biostatistical and Epidemiological Research Design Service. And you can see here that there are 50 co-authored papers and 200 grant submissions that were supported by the BIRD. The CTSI provides free access to about 4 hours of design and analysis support. And then these services also are available for continued use, whether that's more detailed analyses or whether that's actually forming a grant proposal like you see here. And these are world-class design and methodologic experts, and they help us not only improve the quality of our design, but also can help us do it more quickly than if we were to try to struggle along on our own. So the BIRD's a fantastic team. We also launched pre-submission review at Children's National, and you can see that nearly 50 protocols were reviewed through grant year 5. Critical to have eyes on our proposals before we send them out so that we put our very best and most competitive work forward. And then we also were able to balance the reliance agreement between our IRBs to help accelerate. This is a real core theme of the CTSI-CN. We hear from members of our research community what's a challenge, what they're struggling with, what's difficult to navigate, and then we get to work to try to work with those teams to make a cleaner, better, and easier path forward so that you aren't bogged down in the process of research and you can focus on what matters, which is the science and the engagement of your study populations. And then a couple other things we've done as well on the clinical research side. We were able to advance a component within REDCap that allows for e-consent. This has been particularly important during the pandemic, but it's going to be useful regardless. And this is a pretty seamless way to consent without having to necessarily go through the cumbersome processes of an in-person consent. And it's a secure format for doing that. The other thing that Patrick mentioned is having a ready supply of research coordinators so that you don't have to slow the progress of your trials waiting on help. And this is another sort of fantastic resource. And it's also difficult, as you know, I remember being a young investigator, not being able to afford a full-time coordinator, and I was struggling to figure out how to get my project together. So here you can access the support you need, but not more than you need, as your resources may be limited early on. Thanks, Patrick. And then sort of wrapping up a little bit, Encore, which is a clinical trial management system, was implemented effectively. This was a big move forward. We certainly have a lot more to learn, but this is really helping us to advance our capacity for clinical trials. So we're in place at GW, and Children's will go live, if not already, pretty soon. You want to give us an update on that, Patrick?
Yeah, we're underway in phase one of that implementation.
Fantastic. So Encore is a terrific product as well. The other real gem of the CTSI-CN, and I was looking through the attendees, some of you may be former KL2 fellows, but CTSIs allow both the U grant, which is the infrastructure grant, as well as a couple mechanisms for training grants. And the current RFA allows for a KL2 and a TL1 program. In the new version of the CTSA, there'll be even expanded opportunities for training grants. But the KL2, which is a established program at our hub, is just fantastic. It's really one of the best I've seen around the country. It supported 20 KL2 scholars. It is, again, wrapping those early career investigators in support for their research, mentorship, research development training, and also creating their networks that will sustain both them and their work for many years to come. So you can see some of the things that team is really proud of. The fact that every single KL2 scholar had first all their papers within their first 2 years, the KL2, a high level of success in academic careers after the fellowship, as well as great success with extramural funding and that progress towards an independent, at least supported research career. So the KL2 program is fantastic. And we share what we learned about the KL2 program more broadly. Thanks, Patrick.
Absolutely. Thank you, Remer. So I hope you can see, everyone on the call can see some way in which CTSI-CN can help you, help your work, help your research team. If you haven't seen anything yet, feel free to reach out to us individually. We have navigators and folks who are ready to talk about your work and anything we can do to support you. We wanted to kind of close out today with a couple of new initiatives, newer initiatives, ones that have started and ones that are going to be launched in the next few months, just to give you a little bit more of an update about what we're currently focused on. So as I mentioned earlier, one of the a decision that was made by the steering committee of CTSI-CN was to make an improved focus on health equity in CTR. And as you all know, we're seated in one of the most demographically diverse metro areas in the country, and that the underserved communities and populations within our area are disproportionately suffering from rates of poverty and mental illness and poor health outcomes. And so the steering committee to meet some of those, to try to meet those needs and close the health equity gap locally and hopefully nationally, have decided to put a renewed effort on addressing issues of health equity within the research domain. So one of the things we've done for that is launching the Health Equity Toolkit, which is something that we will be working on in the coming months. But we've already started to weave health equity resources and education into everything we offer. So if you go to the virtual organizer, remember, we'll talk about this in a couple of minutes, but there are health equity resources woven throughout every stage of the process. So it's something that when you go to look for a resource, you won't be able to miss another resource that's there to help you think about it from the lens of health equity. We're going to be implementing a community research coalition, which is part of our next series of initiatives. And so that'll be leaders from community groups locally, and we'll be bringing them together for goal setting, for priority setting, but also for consultation and collaboration. So we're going to be working with those folks very closely on and helping them to help guide us in everything that we start and everything we do. We provided a Kickstart funding program for projects focused on health equity issues. You may have seen we sent out a funding opportunity announcement in November. That was quick, but we got a lot of great responses, and we have several projects now that have been ongoing. They're ending in May, but they've all been very successful in their own ways, and it's really helped to get some of these health equity focused projects, give them a little of that boost and that acceleration that we were talking about through the use of some resources and connections and collaborations. We're going to be working on developing health equity best practices for research, and that kind of goes into the Health Equity and Research Unit, which is something that we're currently working on developing as a collaboration between CTSI-CN and the Center for Translational Research here at Children's. That is going to be, a multi-pronged effort, but the hope is that it'll be a center within, or it will be a resource within the CTR and linked to the CTSI-CN that you can come to with any health equity related questions or support needs, and that you'll be able to get immediate support. We'll also be, in addition to hosting tools and resources, we'll be doing external engagement. So we're planning a health equity in research hackathon, which is conveniently the session immediately after this at 11 a.m. with Kevin Cleary. He'll be talking about that, and also the ways in which participating in these fun hackathons is you can make the most out of it. And so I think it's going to be a way to bring folks in the community together to talk about issues of health equity in research and get people creating cool and novel ideas and apps for addressing some of these issues. So that's you'll hear more about the Health Equity and Research Unit later, but we're also partnering with the Pediatric Health Network and the Hospital for Sick Children, involving their practitioners, their clinicians and the researchers associated there, and their populations within everything that we're putting together. And then we're also going to be putting a renewed effort on monitoring EHR study cohorts for representation to make sure that the populations that you're pulling for your research needs are addressing the needs of the community. Remer mentioned Pizzanet. So this is a big big win for us locally. And so a little bit of background on Pizzanet. It was PCORI, the Patient-Centered Outcomes Research Institute, launched PCORI-Net in 2014 to try to create a network of networks composed of interconnected research infrastructures. So that was Pizzanet grew from that as a collection of pediatric centers that would make those connections. And then so with the hopes of creating something of a pediatric learning health system, so it's something that we can all contribute to, these different pediatric hospitals and academic centers could all contribute to, and also learn from one another. So as you can see on the right here, we've recently been accepted for membership in Pizzanet. We're joining a who's who of national pediatric hospitals and academic centers. So as you can imagine, this collaboration with these players is going to be a key player in setting national agenda of healthcare and health services research in the pediatric field. So it's a number of projects and a number of initiatives that Pizzanet is running and that we're going to be participating in, but it's going to involve both data. So, like hosting data sets and improving access to pediatric data from across these and within these partner institutions, but it's also going to be processes and looking at how to manage data and how to manage processes at our institutions. We're going to be learning from one another, and we're going to be participating in this great effort. So this is something that you could also, as an investigator or as a research team, could definitely tap into for some of your work. Now, I'll have Reamer talk about the virtual organizer.
Thanks, Patrick. I'm so thrilled about Pizzanet. I'm so excited about that and what that's going to mean for child health researchers at our hub. So congratulations to the Children's National team for that. It's nice to be in the club with the very best in the country as well, which you are absolutely, which you are. So the virtual organizer was sort of a new invention that came out of the CTSI-CN, and it was really born from feedback we got from trainees and early career investigators that were participating with the CTSI. They were sharing with us some of the challenges and roadblocks and obstacles. And as we heard these issues from other folks, we began to sort of pull it together and then think a little bit like, how can we disrupt this? How can we move some of these obstacles out the way? How can we share some of the tricks and techniques that are best supporting others and bring that together in an easy way? And if you've spent any time conducting research at Children's National or at GW, like any academic institutions, it's a complicated process. The information is dispersed across many, many different sources. And the newer you are to the research process, the more complicated it can be to sort of find your way and find even consistent, clear directions on how to move forward. So we conducted a series of focus groups and individual interviews with early career investigators, research trainees, as well as those that were more established and considered exemplars for clinical and translational science. And then we thematically evaluated all of that feedback and got to work to design a solution that we think will help move science forward and help decrease some of the pain that research teams were facing in trying to move forward through the research process. So the construct is quite simple. It's a work in progress, and it should be an organic entity. So with your feedback and others, we can continue to evolve and grow the virtual organizer. But it's essentially a web-based tool. It's been built in what we call responsive design. So you can do it on a laptop, you can do it on a computer, you can do it on your phone or another device. I hadn't tried it on my iWatch yet, but I'll do that as soon as we hang up. But it's designed in a way to bring together resources and essential best practices and tools to help support clinical and translational research. So you can see here, we shaped it around sort of 8 steps that we consider sort of the pragmatic parts of identifying, formulating, conducting, and disseminating research. And content is embedded in each of these domains. It's highly curated, which means we didn't want to overwhelm folks with a lot of information, but we tried to find the very best in class resources, tools, training, and also to simplify how you can connect for one-on-one help if you need it through each of these processes. So if you are in the process of designing your question, or you're getting ready to develop that first proposal or try to find funding for your research, or maybe you're ready to develop a protocol, or maybe you're ready to disseminate the results of your study, you can zone in on that part of the research cycle and see what we have to offer and get one-on-one help if you need it. So our goal is to boost the quality and efficiency of CTR, but the driver was really to make the research process as simple and easy to navigate as possible for you. So all of your brain power can be focused on your science and not trying to figure out which way to go to get a paper signed or a process approved. We can keep moving forward. And we talked to probably 40 or 50 early career investigators and got a real good sense of what their challenges were. So this web-based virtual organizer, as you can see here, brings together knowledge, tools, and best practices, both from our hub here in Washington, but also what we've learned and continue to monitor from CTSAs around the country. The various groups, Patrick and I have sat in on quite a number of presentations and sessions of other CTSAs, and we're constantly looking for tools and resources to help our teams here be more successful. And we also gathered all of the individuals that help support the CTSI-CN, and we workshop this content. And we have them also constantly on the lookout for problems that investigators are facing and real successful techniques. And we're bringing those back into the virtual organizer to build it. So you can see here the sort of the kinds of information is there. But if you go on the web, and our website is CTSICN.org. We're going to share that with you a few times before we wrap up today. You can access the virtual organizer, and you may see at the bottom of the screen a little Ask a Question tab. It'll kind of open up when you pull up the page on your phone or on your computer. And that's there's a person there. There's a navigator waiting for you. So if you need help, there's also real-time help to answer your questions or get you connected with the person that can help solve your problem. So it's an asynchronous tool that's connected with synchronous help to help you make sure we can move forward. So you can see here some of the kinds of information. Under each, we have sort of this accordion style cascading set of resources. We connect you with local resources, we connect you with NIH, and in some cases where the process may be different at Children's National than it is in GW, we provide you information on your site-specific way forward. We've embedded also in the virtual organizer a calendar that lets you know about all the events that are going on related to research development and networking. You can post events if they're relevant here as well. And we provide you contacts for each of these areas as we move forward. And again, if you share your feedback with us or there's something that we don't have represented, we will build it in. So this really is will be most successful if it continues to be evolved and improved over time. Thanks, Patrick.
Absolutely. So as Remer mentioned, our website is CTSICN.org. You can use the QR codes here. I'll also send out these slides to the registrants and the attendees today, just in case you want to have them for your reference. If you missed anything or we spoke too fast, so you can sign up for the newsletter here. You can sign up on the website. I would say, I would encourage you to go to the website as your first point of contact for CTSICN. We updated the website this year. We tried to make it more user-friendly and a little bit more intuitive. But we have, you can ask a question right there on the page. You can sign up. You can access the virtual organizer. All these things are available right there from the website. We do have, you can email me directly too if you have any questions or needs. But as Remer said, when you hit the Ask Us a Question tab, there's a person at the other end. And if they're not there, you submit a question and it'll be responded to within a business day. So I want to thank everybody, for sticking with us today and learning a little bit more about CTSI-CN and how we can help you. I want to encourage you all to reach out to us if you need anything, or if you want to become involved, or if you have anything that you need help with, but you haven't seen a way through to get that help. I think that Remer and I have both tried to impart today that we offer support. We offer the support that we offer, but we're also ready to answer and help solve problems that haven't emerged or have emerged that haven't come to our attention yet. I mean, we are really a responsive unit, and we take our duty to accelerate research here very seriously. And so I think, please reach out to us with anything you need. These are some of the other sessions that are CTSI-CN sponsored and organized for this week. So, we've got How to Win a Hackathon, which is coming up in a few minutes here. And we'd love to have you for that. That'll be a little bit of a shorter session, but it'll be engaging. Kevin is a great speaker. And then on Friday, we've got some great sessions, one on LC and genomic research and kind of the launch of a new program we're doing called Legacy with Shaniqua Collier from George Washington, who's a wonderful speaker. We've got Duran Wilson, who's our resident staff jack of all trades. He's going to show you, he and Lisa Gay Woodford and a couple other folks will walk through some of the resources that we have in a little bit more depth. So if that was something that you came away with this presentation wanting more information on some of the tools that we offer and the resources that we support, I'd say go ahead and sign up for that as well. These are all, you can find these all on our website as well. And then there's a Docs and Data Science, which is a special interest group that we've been supporting recently for early career investigators, but any researchers or research team members who are particularly interested in data science, issues of data science and access and collaboration. This is a great event to attend and potentially a great group to be a part of on a regular basis. So, thank you very much. Remer, do you have any closing thoughts?
Just to say thank you to all the people on the call and for the work that you're doing. It's essential, and we greatly, we're inspired by the work you're doing. And I also want to give a shout out to Dr. Gabe Woodford and her leadership for the CTSA. She's really heartbroken she can't be with us today, but she's here in spirit. And just to let you know that our success as a hub is equivocal to your success in your research. So there's no problem too bizarre to ask for our help. We exist to serve you and your research team's work. So please don't hesitate to reach out if you think we can be of support to you in any way.
Great. All right. Well, thank you, everyone. I hope you have a great rest of this exciting research week.